I'm Dr. Rob Lagman with Gulf South Foot and Ankle, and today I'd like to talk with you about proper diabetic foot care and stuff you can do at home. Diabetes is something serious that can cause lots of problems such as nerve damage and circulation problems, and this can lead to things like ulcers and infections, and that in turn can cause amputations and hospitalizations. Early detection and prevention of these problems is key to trying to stop this from happening. Regular visits with your podiatrist are recommended at least once a year, sometimes 4 times or more per year if risk factors exist. These risk factors could include history of amputations, infections, and ulcers. It could also include neuropathy, poor circulation, poor control of your diabetes, and foot deformities such as bunions, hammer toes, and bone spurs. Now, what can you do at home? The most important thing are regular inspections of your feet. And this can be done before or after showers, anytime that you have your socks and shoes off. And basically what you want to do is take a look at your feet, check out all the surfaces, the top, the bottom, both sides, and also between all your toes. Now, if you have a hard time reaching your feet, you can use an object like a mirror to try and help you see the bottoms of your feet. And if you don't have a mirror, always use a family member or a loved one, and they can inspect your feet for you. What you're looking for are cracks, sores, dry skin, calluses, anything that looks like a problem, especially infections, which would include any kind of redness or drainage. Those are things that you want to contact your podiatrist immediately. After inspection of your feet, washing of the feet is also important. You want to make sure that you check the temperature of the water. Use something like your elbow so that you can get a good sense of what the temperature is. Your hands and your feet may have nerve damage, which will inhibit your ability to detect what the temperature of the water is. After washing your feet, make sure you dry them thoroughly, especially between the toes. And then you can apply something like a moisturizing lotion or cream, but make sure you don't put that between your toes unless you were directed by your physician. Don't ever go barefoot. You want to make sure that you always have some type of protective shoe on your foot to help prevent injuries from happening to your feet. And when you do put on shoes, you want to make sure that they fit you properly. If they are too big or too small, they're likely to cause irritations or blisters. Now, in addition to that, you always want to check your shoes before you put them on. Look for anything that might be sticking through them. And you also want to tap them out and make sure there's nothing inside that could hurt you either, such as a splinter, a piece of glass, or even an insect or a spider that could bite you. So always check to make sure your shoes aren't going to do any harm. Now, if you do see problems such as infection, cracked skin, sores, wounds, anything that doesn't seem right, you want to contact your podiatrist immediately and get that checked out. I hope this was informative for you. Thank you.